Hi, this is Karen Liberi, and I recently did a video blog post talking about what to expect during your first physical therapy evaluation when you're coming in to be evaluated for pelvic pain. And some very good questions came out of that blog post, including wanting to know more specifics about what to expect during the actual evaluation process. And so I wanted to talk you through that to calm any fears that you might have surrounding the actual evaluation portion. So typically, once we get the history of what's bringing you to physical therapy in the first place, then I usually ask my patients to get undressed from the waist down and hop underneath the sheet. And I do use regular sheets on the treatment table that I use to make it more comfortable. And then I leave the room for you to get undressed and hop underneath the sheets. And then when I come back in, I typically will hook you up to biofeedback to look at your ability for your pelvic floor muscles to relax. And the way that I have that set up is I would have you, and you're completely covered, you would lie on your side, and then I would get little sticky pads on you. So we can see here just like our little pelvis lying on the side, and here is the rectal opening here, and I put the little sticky pads just on the outside of the rectal opening. And then I have you lie back on your back and you're still covered up with a sheet. And then we can take a look at the computer screen together to see your ability to contract your muscles, but really more importantly, I'm looking at your ability to relax your muscles. And then I can take you through some relaxation breathing where I have my hand on your belly and you're expanding your belly into my hand to see if on the biofeedback screen, computer screen, we can see your pelvic floor muscles relaxing. And this is not painful. This is just recording the information from your muscles. And then after we do the biofeedback component, I will then do just hands-on, finding any trigger points that might be creating some of your pain. So I'll have my hands just on your lower belly, looking for any trigger points that might recreate bladder pain, bowel pain, or pelvic pain. And then I will do palpation, just meaning touching the glute or the buttocks area, the inner thigh area, because all of those are places that can refer pain to the pelvic area. And then after that, I get you set up so that you are in a nice comfortable position, again completely covered underneath the sheet, with your legs relaxed out onto the pillow and the other leg just relaxed on me so that your muscles can be completely turned off when I do the pelvic floor assessment. And then I will do a vaginal exam for the pelvic floor muscles, which is different than a gynecologic exam. So I do not use the speculum. So once I do the vaginal assessment, I basically am looking at the 3 different layers of your pelvic floor. I might start off with an external palpation around the vaginal opening to see if there's any trigger points that refer to your urethra, or to just your pelvis in general, or to the rectum. And then I'll do an internal palpation at the first layer of muscles, middle layers of muscles, and deep layers of muscles. So if we can kind of take a look in here, I'm basically just trying to assess all of those different muscle groups within the pelvic floor to see if there's any triggers that reproduce your pain. And the intention is not to create pain, but the intention is to figure out what is contributing to your pain so that then we can come up with a treatment program for you. So hoping that this is helpful to just decipher out further what to expect when you're here for your first initial physical therapy evaluation. Thank you.